Welcome to It's Your Case, presented by vetct.com. I'm Heather, your radiologist on demand for this week. Here we have a 9-year-old lab. The dog is showing acute onset of lip smacking and hard swallowing, and this has been presumed to be due to nausea. Once you've reviewed the radiographs using your systematic approach, then go ahead and watch this video. Now, when we have a patient with somewhat non-specific clinical signs, and we endeavor to make some radiographs as part of our kind of routine clinical database, I think it's important to go into our radiographic interpretation process with some idea of what we're trying to rule out. In this particular case, I think the goal of the radiographs is to rule out some type of small intestinal obstruction, gastric foreign material, something of that nature. Of course, that doesn't stop us from assessing all of the organs, but in general, I think that the goal of this study is to determine whether there's a gastrointestinal lesion that could be causing what is being interpreted as nausea in this patient. So, for cases like this, I like to start by looking at the stomach. Here on the right lateral view, and we have 2 right lateral views for this case and no left lateral view. I'll talk more about that in a minute. But anyway, here's the stomach on the right lateral view. You can see that it's mildly distended and it contains gas, and it also contains granular ingesta. It can be normal to have ingesta in the stomach, especially if a patient is not fasted. I'm going to go to the other view to show. On this view, we can see that the stomach is gas distended and it's less apparent where that granular ingesta is located. I'm zooming out just a little bit in order to give us the ability to trace the colon, because I'm in particular interested in this mixed opacity in the right cranial abdomen. Often when we're looking at gastrointestinal radiographs, we have to differentiate between colon and small intestine. So I always start, and I think I mentioned this in a prior video, I always start with the descending colon because it's usually the easiest to find. So here I am tracing the descending colon. I'm noting it based on its size and the granular fecal content. When the colon is empty, this process is harder. The colon often in dogs goes across the cranial abdomen like the position of the transverse colon, like you see here. Now, in the right cranial abdomen, I'm going to take a little bit of a leap of faith. I can see that the colon is going in this direction with a fecal ball here and a little bit of gas distension. So I'm therefore comfortable to interpret some of this mixed opacity that I see here. Instead of being an issue or a lesion, some of this is probably just due to superimposition of the colon. It's not uncommon in dogs for the ascending colon and cecum to be positioned more here, but for whatever reason in this case, some of the colon has taken a little bit of a loop in that direction. It may actually loop back around in this case where we see this granular contents, but I can't tell you that for sure. If and when you're assessing a case and you feel that you're not sure where the colon is, I would suggest doing a negative contrast colonography using gas. This will help you to evaluate the colon and give you more confidence about its position. So on the lateral view, I can tell that the colon is here, and again, there's a bit of superimposition. So overall, I'm okay with the colon and with the stomach, but I want to make the note that the stomach is a little bit distended and contains some granular ingesta. Now, the next thing that we're always interested in would be small intestine. I'm pointing to multiple small intestinal loops here. I'll put some arrows. All of these small intestinal loops that I'm seeing have some similar features. In particular, what I see is that their diameter is normal and not enlarged, that the contents is either a little bit of fluid or gas, and that there's no segmental enlargement. So, where I would land in this case is that there's no evidence of small intestinal obstruction whatsoever. The gastric contents can easily be normal ingesta, and I would not want to overinterpret this as foreign material, especially in a dog that's not vomiting. So, for this case, I would say that the abdomen is unremarkable, provided that we can confirm that the patient had recently ingested a meal. I would suggest follow-up radiographs to ensure the gastric contents are just normal ingesta and pass, only if the patient has clinical signs such as vomiting. Otherwise, it's probably okay to trust the fact that this is the appearance of normal ingesta. Be sure to review the full report associated with this case. Thanks for listening, and remember, it's your case, so please post your questions on social media.